Hello, everyone. Thank you so much for joining this session. We are session 2B, where we will be discussing research advocacy and making person-centered research happen. My name is Mary Mukira. I'm the manager of grassroots advocacy over at NPAF, and I will be your session moderator for this session, and Dr. Rebecca Angove will be leading this discussion here. So first and foremost, I would like to thank all of you for joining Patient Congress today and joining our session, and would also like to thank our sponsors for making this event possible. And just to briefly touch on some general housekeeping for this session, please submit your questions into the Q&A box in the control panel, and we will be answering some of your questions at the last 15 minutes of this discussion. Closed captions are available for this session as well. And please keep in mind that at the end of the day, materials will be emailed to you with the session slides. And if you're experiencing any technical difficulties, please feel free to email npafevents@npaf.org. You are able to join our conversation on social media using the hashtag #HealthNeedsNav. And we would love to get a sense of where everyone is joining us from. So if you feel so compelled, please in the chat, drop your name, your state, and any organization that you may be affiliated with. So without further ado, I will go ahead and turn this over to Dr. Rebecca Angove, who is Patient Advocate Foundation's VP of Patient Experience and Program Evaluation. And you also heard from her earlier today.
Thank you so much, Mary, and thank you to everybody for joining our session. Thank you for being here. I am coming to you from New Orleans, so I am in Louisiana, and I'm excited to see where everybody else is coming from today. So this session is all about really explaining and exploring patient-centered outcomes research and helping our attendees understand how person-centered research happens, what it is, and also how we can all be involved in it, because I know there's been a lot of interest in not just learning about it, but also actually rolling up your sleeves and getting involved in this type of research. So we'll jump into the slides, and today we are going to be together for 45 minutes. I'm going to talk for about 20 to 30, depending on how fast I go, and then we'll have time for Q&A at the end. So research has been around, I'm just going to say forever. It is something that is where all of our treatments and drugs and knowledge really comes from. So when I talk about research, though, I'm specifically going to be talking about healthcare research. So not just clinical research, but also all the research that goes into understanding quality, understanding how healthcare is delivered, and understanding how treatments affect patients. So this goes beyond just clinical trials. Healthcare research is a very, very broad topic. And this is a statistic that has been around for a while, and it's not getting better. It's been calculated that it takes about 17 years for research results to be translated into practice. So once a researcher has an aha moment, it takes 17 years to actually change the way treatment and medicine is done. That's a really, really long time for patients waiting for treatments and results. And really, we need to do better. One of the ways that was kind of thought up to shorten this time from results to translation and get treatments to patients that are both quicker, but are also more relevant to patients' needs is what is called patient-centered outcomes research. You'll hear this called PCOR, PCOR, but really the focus of this research is to help patients and families make better healthcare decisions, to ensure research focuses on what is most important to patients and their families. So not just what a researcher has spent his or her career on, not just what a researcher thinks is important, but what patients really feel is important. Patient-centered outcomes research also wants to improve the quality of care and disseminate this health information, not just shelve it somewhere where it's going to gather dust, but really once those results come out, how can we turn that into action? How can we make sure that those results are getting to patients, are getting to providers, and are being translated into care improvements? And then also really help patients understand their options and the benefits and harm. So at the end of the day, patient-centered outcomes research really wants to give patients the information and the tools they need to make better healthcare decisions and improve health outcomes. So we're going to dig into this a little bit deeper. What are patient-centered outcomes? Because it's in the name, we're talking about it. It's just what it sounds like. Patient-centered outcomes are the outcomes that matter most to patients. So they can be medical, they don't have to be, but it really is this idea that the outcomes that are important to you, the patient, can incorporate your beliefs, your opinions, your needs, and that's in combination with your physician's medical expertise and assessment. So this is really, really central to shared decision-making and patient-centered care. And these outcomes range from clinical outcomes. Just because they're patient-centered doesn't mean they can't be clinical outcomes. They can be related to quality of life, but they really integrate voice and the perspective of patients and their families. So when we think about patient-centered outcomes, that brings us into patient-centered outcomes research. And really, again, it's just like it sounds. Patient-centered outcomes research, or PCOR, is research that is based on, it's foundational to understanding what patient preferences are. It focuses on symptoms and outcomes that are most important to people. And I think really the key to this is, if your research is focused on what matters most to patients, caregivers, to people, you need to listen to people and engage with patients and caregivers to understand what to research. And so patient engagement really is at the heart and the core of patient-centered outcomes research. So what do these research questions look like? What might a study look like? I mean, really, to me, patient-centered outcomes research focuses on things that I think research should have been focused on all along. For example, a patient-centered outcomes research question could be, what are the benefits and harms for treating children with oral versus intravenous antibiotics? What are the pros and cons of different types of cancer treatments? Which works better, pain education or talk therapy to help people with chronic pain? So really thinking about the treatments, the outcomes from a patient perspective, and patients can help craft those research topics and the focus. So you may or may not have heard of patient-centered outcomes research. You may have been involved in research projects, but there are a number of large organizations that are really pushing for this to be the approach to research. PCOR is a big one. Patient-centered outcomes research is right in their name. They are the Patient-Centered Outcomes Research Institute, along with the Department of Health and Human Services and the Agency for Healthcare Research and Quality. All of these large funders are driving patient-engaged research, requiring engagement, really because they want to fund studies that can improve outcomes and help patients. They don't want to see results sit on a shelf and not improve patient outcomes. They don't want to see results take 17 years to translate into new treatments and improved health outcomes. And so there's been a really heavy investment from these and other funders to both engage in patient-centered outcomes research, to support researchers that are doing this work, and to make sure that patients are engaged meaningfully in these projects. So I'm going to go through just a little bit of the PCOR approach to patient-centered outcomes research. This is a small snippet of a training that they have. I'm going to take this audience through just a few sessions of it, a few slides of it. But this is a much larger training that if you're interested and if this kind of whets your appetite, I can give you information on going through this much longer self-paced training. So PCOR, the Patient-Centered Outcomes Research Institute, is really doing a lot of work to both fund this research, but also train researchers and patients how to engage successfully in this work, because this is new for not only patients, but also for researchers doing this type of research where patients and other stakeholders are engaged. And, as I've touched on earlier, traditional research, often has different different priorities, different focused areas than patients have. So, a researcher may focus on a very scientific, specific question, a specific chemical, a specific treatment or disease mechanism, which may be interesting, and it may advance some of the treatments and cures necessary, but oftentimes patients have much different questions and usually related to treatment risks and benefits, side effects, and their health outcomes. Often knowing that information helps patients make day-to-day decisions when they're choosing between healthcare options. You can't have shared decision-making if patients don't understand the differences between these options. And oftentimes this is not aligned with what research is studying. And so what might this look like? This is the type of question patient-centered outcomes research answers. For example, I want to make sure my condition doesn't lead to more serious health problems. What treatments should I consider? Will those treatments help people like me avoid those problems? And is no treatment a possibility? And, when patients say people like me, I think another real focus of patient-centered outcomes research is making sure that treatments are focusing on how different treatments affect different people in different ways. Another example, and I love giving these examples because I think it really takes an abstract idea and puts it into the words and thoughts of patients and what they want researchers to focus on. So here's another patient-centered outcomes research type question. This woman, I'd like to do everything I can to keep my energy up while I'm using this treatment. Will this treatment affect my energy? Are there things I can do while I'm taking this treatment to help me stay energetic? A very, very important question that providers may not think about, but is very important to a patient's quality of life. So really, the idea is that we're moving just having knowledge to making decisions and focusing a lot on what patients and caregivers need to know, specifically around the options that are available to them to prevent, manage, or treat a health condition, and really incorporating their values and preferences. Sometimes that's quality of life, so they can continue to work or do their favorite activities, spend time with family. Sometimes this is really driven by cost. Patients really want to know the treatment, if a treatment is something they can manage in terms of cost. And sometimes it's about more serious complications or side effects, and not just quality of life, but length of life. So these are all things that patients are thinking about. And researchers need patients and caregivers' experience and expertise to guide research. Researchers don't understand the nuances and these different things that are important to patients, like patients do. And so this idea of incorporating the patient and caregiver experience into research is invaluable. So how does this work? There's a lot of different models for it, and I'm not going to, sit here and go through every different model. Is it a focus group? Is it an advisory board? Do you have a patient researcher that works alongside a researcher? There's probably 100 different ways to do this and do this well, depending on the project and depending on the patients and other stakeholders, caregivers involved. But really, at the end of the day, what's happening is that you get patient input. And when I say you, researchers get patient input. And then the goal is to really translate that together as a team into these patient-centered research questions. So a patient likely is not going to be expected to come to a research meeting and say, does depression always include social isolation? It's a great question, but patients and caregivers that are involved in research aren't being expected to come with a polished question. Oftentimes, patients just sharing their story, just sharing their input and their perspective. You know, I'm feeling tired all the time and I don't want to see my friends. Could I be depressed? Those kind of comments, that sharing their experience, can often lead to these patient-centered research questions that are important to advancing the science of a condition or a disease, but also improving treatments and outcomes. So I thought I'd break up the session a little bit and share what this really looks like from a patient perspective, from an actual patient perspective. So I have a couple videos, fingers crossed they work, that can really talk about what it's like being involved in a research project and really talk about the patient role. And again, like I said, there's probably at least 100 different models for this, but the patients and caregivers are working alongside researchers. So they are not, it's not just a survey, although it sometimes is, but often they are advisors to research. They provide perspective and direction on every decision. They're right there at the table. Patients can inform what questions to ask, as we've seen. They can also inform what data to collect and how it's being collected. Once the data comes in, stakeholders, patients, caregivers, they can advise researchers on how to understand the findings. A lot of times patients can interpret that data in a patient-centered way that a researcher may not be able to. And then also understand, how do we share this back and have patients understand these findings? And then patients and caregivers also work on specific tasks to make materials, recruitment, and some of these dissemination activities, sharing the results, more community and patient friendly. So it's not just researchers talking to researchers anymore, but it's really researchers talking to entire communities. So if this video works, I am going to have Gwendolyn speak a little bit about her experience. Mm-hmm. Oh, is there a way we can fix that? Oh no, I was told the audio may not be coming through, which is a shame because this is such a great video. I am not tech savvy enough to understand because I could hear the audio. So I think we're going to skip the videos. And to the audience, this deck will be sent out and those videos will be embedded. So I'll make sure that you all get the video of both Gwen as well as Neely. And Neely is a dear friend of mine. So I will make sure that you get those links And you can watch these videos on your own. They're only about a minute and a half. So they're just a great little insight into how patients are partnering in research and on research projects. So really what I want to focus on now that we know a little bit more about what and how patients have been involved, I just want to talk about this idea of engaging stakeholders in research. So engaging stakeholders in research is it's still fairly new in the healthcare research space, but it's becoming more and more widespread. And they have found that when you engage stakeholders, patients, caregivers, clinicians even, it really makes research questions more relevant. It makes outcomes that are studied more meaningful, so really focusing on what patients care about. It helps make these findings more accessible. And I really think this is one of the most exciting things. Oftentimes research results are buried behind paywalls in medical journals. They're hidden in very jargony, thick language. Even if you can get your hands on an article, they're shared at conferences that patients are often not invited to, and to be honest, very cost prohibitive to go to. And so when we can involve patients and caregivers in the research, that also includes involving patients and caregivers in how to best disseminate the research results. And I think the last thing is that the engagement of patients and caregivers also really promotes trust in the research ecosystem. This has been something that, it's almost don't look behind the curtain, right? Research has been happening for many, many years in spaces that have not been open to patients and caregivers. And so by having this increased transparency, by inviting patients into the process, you're not only improving the research that's happening, but you're also really promoting trust in this research process and the research ecosystem. So I really think involving patients and caregivers is central to that issue of trust and researchers being trustworthy partners. So how are we doing this? And I said it now 3 times, there is a million ways to engage patients in research. The one way that we're focused on right now, and this is part of the Patient Insight Institute, is developing learning communities. And so what is a learning community? This term's used in a lot of different areas, a lot of different fields. And so when we talk about a learning community, we're really talking about a space and a structure for people to align around a shared goal. And that can be aspirational as well as a practical goal. Learning communities also, they connect people, they connect organizations and different systems that are eager to learn and work across boundaries, again, focused on a common agenda. And when we're thinking about people and organizations, we are looking at connecting patients and caregivers and researchers and clinicians, and depending on the topic, potentially even policymakers in this learning community where participants really learn from each other. And I think that's the kind of the beautiful part of this learning community. It's not a whole bunch of smart people telling the rest of us what we should be thinking. It's not just patients and caregivers telling researchers what to do. It's not just researchers telling the policymakers what to do. It's really a round table where everybody's learning from each other, their experiences, and really improving the ability to achieve, rapid and significant progress. So this idea of a learning community is something that we're going to start. And one of the ones that we are starting is a COVID learning community. Now, I know you are all probably as tired of COVID as I am. I really thought I'd be in person with everybody today, maybe next year. But we really, really want to understand and build a COVID learning community around COVID-19 and the impact that the pandemic has had on individuals. And this is regardless of if you've had a COVID diagnosis. So this idea of a COVID learning community is really having patients, caregivers, providers, researchers come together and shape the health research that is going on around COVID-19. And again, we are going to be looking at topics related to a COVID diagnosis, but also topics that are really relevant and understanding the experience of patients and caregivers that maybe didn't have a COVID diagnosis, but were negatively impacted by the pandemic in other ways, and potentially because of, for example, challenges with employment, challenges accessing the care and treatment they needed for another condition. There's been a lot of disruption that COVID has had to all of us, even without a COVID diagnosis. So through this COVID learning community, everybody in it will receive training about COVID-19 and research in self-paced modules. So what I presented to you this morning was just a small taste of some of that training. So you're going to really get into the weeds and understand what is patient-centered outcomes research, what is research, and so kind of really get into the weeds on that, as well as COVID-19. We're also going to have meetings where we can learn from each other and discuss research projects. So you'll be able to network with patients and researchers and really get involved in some patient-centered research projects, and also really prioritize what some of these projects should be focusing on. So not only bringing your perspective and your ideas to a group, but also, shaping the research that's being done. So the commitment is completing online self-paced training over the course of the next year and a half. We're going to be having meetings and sessions, and then to participate in at least one quarterly interactive workshop. So we know you may not be at everyone. We'd love it if you can. But if you want to be part of the learning network, we only ask that you participate in at least one of these workshops. And again, the impact of this, I think, could be really great. So, personally, you can improve your knowledge of PCOR. But I think, externally, aside from kind of what you're going to learn personally, what you can share with others is going to be invaluable. You're going to help us develop trainings and inform, the development of these trainings, both what we're training patients and researchers on and how we're doing it. You're going to influence patient-centered outcomes research priorities, what researchers are focused on, how they're doing their projects, the opportunity to be part of those projects. And of course, you're going to meet some great people along the way. So I did save a little bit of time for Q&A, but I'm going to put this slide up as our formal invitation to join our COVID learning community. It is an initiative of the Patient Insight Institute and PAF. And we invite you to email me directly, and I will make sure that you get on the list and access to our spaces and resources and invited to our meetings.
Thank you so much, Rebecca, for that presentation. We have a few questions. I believe you answered this recently with sharing the COVID learning community. But one of the questions we have is, after patients and caregivers participate in patient-centered outcomes research, do researchers typically follow up after some time to share how their input improved treatment and outcomes?
That's a really, really great question. So the answer is it really varies from researcher to researcher. They should, and I think the good ones really do. If you have been involved in a project where you haven't had a researcher or a member of the research team follow up with you, I encourage you to be proactive and reach out. I know the projects that I'm involved with, every step of the way, I try to show patients not only big picture how they've influenced the research that we're doing, but even the small steps. So the goal is that patients have influence and decision-making and kind of co-ownership of a lot of the decisions. And over the course of being part of that study, hopefully they can see that their input has been valuable and how they've shaped the research. But if not, absolutely feel free to reach out to any project and researcher that you've been involved with and ask them. And if you're involved in the COVID research community, absolutely central to what we do when we're involved in these projects is not only kind of taking your input and making sure it influences the work, but also making sure that we're sharing how we're using it, what has changed and the impact you've made. I think there's always a challenge, how do you quantify that? So measuring that impact is hard. But I do know from the number of projects I've been on that the research would have not been as good, would have not been as patient-centered, and it was just higher quality because patients were involved. And really it's because researchers don't think like patients and patients don't think like researchers. And so when you bring those two groups together, I think that's when the magic happens.
Thank you. We have another great question. What can I do to prepare for joining a research session like this?
So a really good question. Being here was the first step. I hoped that this gave you a little bit of kind of info and insight into what research is, so you can learn a little bit of the language, of how you can be involved in what your role as a patient could and should be. There's a number of research trainings out there for patients and caregivers, non-research stakeholders. And we are going to share those trainings with our learning community. Maybe we can make a note, Mary, that we can include a few of those in some of the follow-up materials from this session as well. Would love to share some with you. So there are a number of really good online self-paced training. And I think the other thing that you can do if you're going to be part of a research team is really just be open and confident in the value you're bringing to the group. Don't be scared to, speak up. Don't be scared to ask questions, and don't be scared to disagree with the researchers in the room, right? Don't have the white coat syndrome where you think you don't know as much because you're not wearing a white coat, or you don't have doctor in front of your name. Speak up and share your perspectives with the researchers, because that's why you're there and that's why they need you.
Thank you. And there's another question. So how can people get in touch or involved in a research project? How does that process look like?
So I love this question. And I will be very, very frank and honest. I get questions all the time from researchers, and they ask me, where do I find patients? And I laugh because, PAF, we work with 130,000 patients a year, and PAF has a whole cadre of patient advocates and volunteers. And there is just a number of other patient-focused organizations out there. So patients are not hard to find, and patients are always more than willing and excited to participate, especially as a research advisor and partner. So to answer your question, it's hard because there isn't a public place, for example, that researchers can go and say, hey, I'm looking for a patient to partner on my project. Oftentimes, researchers rely on their network or an organizational partner. And that's one of the reasons that we started the Patient Insight Institute, was to really give researchers a place that they could go and connect with a very diverse group of patients, diverse from the communities they live in, the diseases and conditions they have, their, the experiences and the treatments they've had, to make sure that a very diverse and representative voice are included in these research projects. And so one of the things that we're going to be doing, again, through learning communities and other projects, is to really be a hub where we can connect interested patients to researchers that want to involve patients in their research, on their research team and as advisors. So I think one of the first things you could do If you're connected to other patient organizations, reach out and see if they have any research projects going on. Join, this learning community, or keep watching your inbox for other learning communities that we're going to be developing, because the Institute's going to be doing a lot of that connector work.
Thank you. And I know we have about 5 minutes left. So to include some of the last ones, do you know if patients and caregivers who join a project are compensated for their time and expertise?
So that is a really, really good question. And again, it's very dependent on the research project. But for the most part, I am seeing the tide really turning to making sure that patients and caregivers are compensated in an equitable way, because the expertise they bring is invaluable. So I'm not going to say that you should, but it is usually the norm that for a lot of the activities, especially when it comes to a funded research project where you are an advisor, where you're a partner, a lot of that is compensated. You're compensated for your time. I know Mary and I are working on a project right now that is funded through the Patient-Centered Outcomes Research Institute through PCOR, and all of our patient and stakeholder advisors are compensated for their time. So it is something that is not out of the realm to expect.
And is there a way to get involved in a project where they may not necessarily be looking to include patient or caregiver perspectives?
Oh, I love this question. So that's a hard one. I did share that this is a new way of doing research. A lot of researchers aren't that skilled or experienced at including the patient voice. And it does take more time, more money, more resources to, include that extra layer of patient involvement. But that being said, I think if you know of a research project going on, asking them how they're involving patients, and if they're not, asking them if they would be open to involving patients, maybe sharing some of these resources, maybe going to the PCOR website and showing them, this different way of doing research. I think that would be a great thing to do, to reach out to those projects and, offer your insight as a patient, because you do have a very valuable perspective and expertise to bring.
So we have about 2 minutes left. Are there any additional questions anyone would like to ask before we close out into the main stage again? One question we have, so once the research concludes, the research project concludes, and there may or may not be follow-up with the participants, is that data separate? If they were to share with participants, patients and caregivers, is that data separate from the data that they would share with communities at large?
So usually being part of the project, you're not going to get any super secret special data. You may get the results earlier. You may be able to help shape the results. But I think one of the most valuable pieces of having patients involved is helping find ways so it goes to communities, providers, different audiences that the researchers may not even think about or know how to reach. So you could shape that message and how it's being shared with the more general audience. You likely won't be getting any, super secret insider information, but it still feels really, really good to make sure that data and that information is shared in a way that really resonates with the community and helps improve care and outcomes.
Thank you so much. And thank you all so much for joining us today for this session. Our upcoming session, the closeout for the day, is titled Policy Strategies to Advance Needs Navigation, and that will begin at 2:15. So I will go ahead and drop in the chat the link for that. It's going to be the same link that you used to enter the Larger Patient Congress. So thank you all so much for joining, and we will see you shortly.